Current state of finance across Manchester is extremely tight. We have over the last couple of years been able to just about balance the books across GM, but each year gets harder and harder. Real pressures on social care and the link between social care and NHS funding. So whilst we've been able to balance the gap on the healthcare side of things over the last couple of years, we've not been able to deliver on the social care gap. So we've used a significant amount of historic local authority resources and reserves to deliver on social care. So we really need to see a fundamental change in both how we deliver health and social care across GM and also a long-term funding settlement that enables us to see with some certainty how much money is going to be available to deliver that transformation. So I think in Greater Manchester we are at a kind of pivotal point. We have had a number of opportunities. We have got a transformation fund that came as part of our devolution deal that's enabled us to invest in some of the things that we see as the real transformational opportunities. So taking care outside of hospital, integrating health and social care within local communities, populations of between 30 and 50,000 being the real key to delivering that. But we're at a crunch point where actually the pressures at the moment on the acute side of the health system continue to grow, whilst at the same time we're trying to deliver those alternative care solutions. So I think the real risk in the coming year is that we end up sacrificing some of those transformational opportunities just to balance the books in the short term, and I think that'll be a real danger because we will lose this opportunity that we've got in Greater Manchester to make a once-in-a-lifetime change to how health and social care is delivered. So we need to make sure that we do our best to manage the short-term financial issues, but make sure we don't distract ourselves from the fundamental changes that we're trying to deliver, because if we do, we won't get this opportunity again. So I think we've got a number of areas where we're working really closely with the 10 localities across Greater Manchester to support them in delivering transformation. I think the key thing that we need to do in the year ahead is to make sure that alongside doing that we also maximise the opportunity to deliver some immediate savings in the acute sector. So particularly looking at what we can do by working together across Greater Manchester to make sure that we can manage the immediate pressures on the acute side of the system, whilst at the same time not distracting ourselves from delivering transformation. So work that we could do around things like procurement, around agency staffing, and making sure that we're really getting the most of the opportunity that working together at Greater Manchester level provides us to make sure that we can keep delivering some of those short-term savings, but without missing this opportunity around transformation. That is the key to all of this, both in Greater Manchester and elsewhere, is to make sure we maintain really positive relationships between the different parts of the system, so between providers, commissioners and local authorities. The only way we're going to come close to delivering on some of these challenges is by those three parts of the system working really closely together. It's the only way we'll deliver, both in terms of finances but also particularly around things like the urgent care agenda, to make sure that people are getting out of hospital in a timely fashion, that they aren't being admitted when they don't need to be, and that the services in the community, both from healthcare but also social care and wider public services, are working as closely as possible together to deliver the best outcome for patients.